Kara, go ahead and come on in and take a seat. Hi, my name is Sierra and I'm going to be your nurse today and giving your assessment. Is there any questions or concerns you want to talk about before we do this?
No, I'm good.
Okay, awesome. Can you go ahead and state your name for me?
Kara Lee Kane.
Okay. Can you state your date of birth for me?
02/03/99.
Okay. Can you tell me why we're here today?
I'm just getting a checkup.
Okay. And do you know where you're at?
Yes, Mac.
All right. Awesome. So I have a few questions for you. And they're going to be about your history, okay?
Okay.
For your past history, have you ever had any serious illnesses such as influenza or rubella or measles or mumps?
No.
No? Okay. Any other serious injury or serious illnesses?
Nope.
Have you ever had any serious injuries or any serious surgeries?
Nope.
No? Okay. All right. Have you in the past taken any medications, and do you currently take any medications now?
Nope.
No for both?
No.
Okay. All right. Do you have any allergies to anything? Medications, seasonal allergies, food, animals?
Nope.
Okay. Must be nice to be you. All right. So I am going to check your lymph nodes. Is that okay with you?
Yes.
So I'm going to touch you and palpate your areas. If you feel any tenderness or pain, go ahead and tell me and we'll stop and assess it right then and there. Okay?
Thank you.
Let me just put on some hand sanitizer. Okay, my hands are kind of cold. Sorry about that. Okay, I'm going to go ahead and reach under your chin. And then I'm going to go periocular, so in front of your ear, and postocular behind your ear. And then I'm going to go behind your subjugular mastoid. And then I'm going to go ahead and check the front of your throat as well. And then I'm going to go down and check your lymph nodes on your clavicle area. Okay, did you have any pain or tenderness with that?
No, ma'am.
All right, all of your lymph nodes seem to be doing well. There's no enlarged areas and there's no tenderness and no pain, correct?
Mm-hmm.
Okay. So I have a few more questions for you. Have you had all of your flu shots?
Yes.
Are they all your immunizations up to date?
Yes.
Okay. No flu shot. All immunizations up to date. Okay. So I have another question for you. Have you ever used tobacco?
No.
No tobacco use, whether smoking or smoking less?
No.
Okay. Have you ever drank alcohol?
No, ma'am.
No. Do you have any recreational use or substance abuse?
No.
Okay. Awesome. That's good for you. You should keep that up. Okay. What's your occupation? Or what do you do for a living?
I am a student athlete.
Oh, okay. So you don't really have time for that.
No, don't have time.
Okay. So I have another question. Do you feel safe while you're at the school?
Yes.
Is there anyone that you're particularly afraid of?
No.
Anyone that concerns you?
Mm-mm.
Do you go home for breaks?
Yes.
Is there anyone that you're scared of there?
No.
Do you feel safe at home?
Mm-hmm.
Okay, awesome.
Very safe.
Okay, so I am going to have you extend your arms for me, if you will.
Mm-hmm.
All the way. Can you flex them for me? Awesome. Can I check your hands and your trigger? Trigger's great. Cap refill's awesome. I'm just going to inspect your arms really quick, make sure there's no scars, no deformities, no discoloration. Your skin is pink and warm, not pale, not clampy. Does anything hurt on you? Does it feel okay?
Mm-hmm.
Any
Good.
pain? Okay, awesome. All right, so now I'm going to go ahead and check your the back of your throat, inside of your mouth, and up your nose. Before we start this, do you have any hearing or visual aids?
No.
You don't wear glasses or contacts or have any hearing problems?
No.
Okay. All right, so for this, I'm going to have you say "aw" for me, and I'm just going to look inside of your mouth, okay? Say "aw." All right. You can stop saying "aw" now? No, keep going. Okay, so your uvula looks great. It is symmetric and in form and equal on both sides. Your buccal mucosa looks really great. Your gums look awesome and your teeth look good. Can you stick out your tongue for me? All right, and your tongue is intact and it's symmetrical. Okay, so now I'm gonna go ahead and turn off the lights and I'm gonna check your pupil reaction. Just to make sure that they're equal, they are responsive, and they both do it at the same time when shown through the light, okay?
Okay.
All right, it's a little dark. So I'm gonna check your left eye first. Okay, awesome. And then your right eye. All right, awesome. All right, so both of your eyes were equal and responsive. They were both reacting well to light, and they constricted and then dilated to their perfect size that they're supposed to be. So I'm gonna go ahead and say Perla for that, okay?
Okay.
All right, so now I'm gonna go ahead and listen to your heart, okay?
Okay.
Sorry.
No, you're fine.
Okay, once again, if you feel any pain or tenderness, just go ahead and let me know, okay?
Okay.
Okay. So now I'm gonna check your aortic valve area. Awesome. I'm gonna go ahead and check your pulmonary. Okay. And your tricuspid. Awesome. And now your mitral valve, okay? All right. All 4 areas of your heart sound clear and they sound good and they sound symmetrical. I do not hear any swooshing of your hearts and I don't hear any abnormal sounds. So I'm gonna go ahead and say that is good. Oops. Okay. So before I go ahead and have you lay down, I'm gonna check your grips, okay?
Okay.
Can you go ahead and grab my hands and squeeze? Awesome. Both of those are equal and they respond at the same time. Can you extend your feet for me? Can you push against my feet? Awesome. Your pedal responses are great.
Thank you.
So I'm gonna go ahead and say +4 for both of those. All right. So now I'm gonna actually listen to your chest before I have you lay down, okay?
Okay.
And for this, I'm gonna need you to take a deep breath with every time I move my stethoscope, but I'll also let you know when. Also gonna put on more hand sanitizer. Okay, take a deep breath. And again. And again. And again. One more time. Again. And one more time. Okay, your posterior lung sounds sound great. Can you go ahead and turn around for me and I'll listen to the back? Thank you. Okay, go ahead and take a deep breath. All right, awesome. Do that again for me. That sounds nice. Can you do it again for me? All right, again. Okay, again. And again. Awesome. Your lung sounds sound perfect and they sound equal and symmetrical. I don't hear any crackles. I don't hear any wheezing. Have you had any drainage recently?
No.
No? Do you feel sick or like have a cough?
No.
Any congestion?
No.
Awesome. All right. So now I'm going to go ahead and have you lay down. Oh, actually, I'm going to go ahead and check your pulses really quick if that's okay with you. Can I see this wrist? Thank you. So I'm going to check your radial pulse right now. And then I'm going to check this one. Both radial pulses feel symmetrical. I'm going to go ahead and check the ones on your neck, which is called your carotid, okay? Okay, your left side feels good. All right, both carotid arteries seem to be feeling great, and I can feel them, and they're feeling great. Do you feel lightheaded or dizzy?
No.
Any pain or tenderness when I tested those?
No.
Okay, go ahead and lay down, and I'm gonna go ahead and check your pedal pulses as well. Okay.
Okay.
So right now I'm gonna check your dorsal pedal pulse. All right, that's good on the right foot, and I'm gonna check on the left foot. All right, that's good on the left foot. And now I'm gonna go ahead and check your posterior tibial pulse, okay? All right, that one's great. I'm gonna go ahead and check this one. Okay, awesome. Those are great. All your pulses are equal and symmetric, and they don't feel they don't feel slow, and they don't feel too fast. Do you feel calm right now?
Mm-hmm.
You said no pain and no tenderness?
No pain.
Awesome. Okay, so now I'm gonna go ahead and check your bowel area, so your abdominal area. Can you go ahead and pull up your shirt for me? Okay, so as a general expression on your stomach, I can see that you have no scars, no abrasions. Your stomach is not heavily bloated out, so not ballooning, and it's not super concaved in. I see that you have your belly button pierced. Were there any complications with that?
No.
Okay, awesome. I'm gonna go ahead and listen to your stomach now, okay? If you feel any pain or tenderness upon this, go ahead and let me know, and we can stop the assessment, okay? Sorry, I'm just gonna put more hand sanitizer on my hands. All right. I'm gonna start in your lower right quadrant, okay? I'm gonna work my way around to all 4 quadrants. Awesome. Bowel sounds were equal and symmetric in all 4 quadrants. Have you had a bowel movement today?
No.
No bowel movement today? Is that pretty common?
Yes.
Is it common for you to sometimes, what is your common bowel movements? Like, what's common for you?
1 every 2 days.
Okay. Do you take any laxatives or any stool softeners?
No, ma'am.
All right, sounds good. Okay, so can you go ahead and sit up for me? And can you stand up for me?
Yes.
Okay, so I'm gonna have you take your fingers and place them to your thumb like this and work it on your way back with one hand first. Awesome, can you do that with the other hand? All right, great. Can you go ahead and face this wall, stick your arms straight out, and close your eyes. All right, awesome. And by this, I can tell that you have a good sense of balance, and when you were walking in, I could tell that you had a great gait. Did you ever at once feel dizzy, lightheaded?
No.
No? Any confusion or anything like that?
No.
Okay, awesome. So I'm gonna go ahead and have you take your shin and drag it up your heel and drag it up your shin and back down. And can you do that with the other leg? All right, awesome. Can you turn around and face that wall for me? So I'm gonna go ahead and have you take a deep breath. Awesome. Thoracic expansion is normal, equal, and symmetrical. Okay, so I'm gonna go ahead and have you say the word 99 for me.
99.
Can you say it again?
99.
One more time.
99.
Okay, tactile formitis is intact and symmetrical. All right. I think that's the end of our assessment. Is there any questions or anything that I can answer you before I go and get the doctor?
No, ma'am.
Okay, awesome. Thank you.
Thank you.